Today we're going to be talking about rotator cuff injuries and tears, including what they are, what causes them, and how to know if you really have to go underneath a knife in order to get complete relief of your pain and get back to doing the things you love. I'm Dr. Amy. I hold a PhD in Orthopedic Manual Physical Therapy, and I believe strongly that movement is life, and you deserve both. Many people who go to the doctor with shoulder pain have an MRI, it shows a rotator cuff injury, and they're told that the only way to heal it is surgery. Or they're told that the best way to heal it is surgery. And that is not always the case. But it is really difficult when you're standing in front of an orthopedic surgeon who is telling you that the only way to solve this problem is surgery. We believe them, right? They're doctors, they know what they're talking about. But actually, a rotator cuff tear is not necessarily as bad as it sounds, and it can heal on its own without surgery. So let's start by talking about what is the rotator cuff and what are we actually talking about today. So the rotator cuff is made up of 4 muscles that actually help to hold the humerus or the arm bone into the socket. So there's 4 muscles that surround that area that help to hold it into the socket, which allows your shoulder to be able to move in all of these different directions. A really interesting little side note is that if you think about it, your pinky is attached to your axial skeleton. So we're talking about the head and the spinal column, the pelvis, all of that stuff makes up your axial skeleton. So your pinky, the only bony attachment it has to your axial skeleton is right here. This is called your SC joint. So if you think about it, that means that all that stuff that's happening in the shoulder, in the elbow, in the hand, it's all muscles and joints interplaying, but it's not actually interacting with that axial skeleton except for right at this joint. So a lot of people wonder, why are rotator cuff injuries so common? And the reason why is because there's not a lot of joint stability actually going on in the shoulder. So the muscles are required to help stabilize that shoulder and provide that entire range of motion. So you can do all the things you want to do, like lift overhead or push something in front of you or pick up your children. And that's why the rotator cuff is so commonly injured, because we literally use it to do basically everything in life. So what causes rotator cuff injuries? Most commonly what I see in the clinic is an overuse injury. So you're doing a repetitive motion so many times and it just kind of wears down those rotator cuff tendons. There are other reasons, one of them being poor posture or ergonomics when you're at your workstation. So if we're in this forward bent position regularly throughout the day, it makes it difficult for those rotator cuff muscles to actually work the way they're supposed to. So they need to be in the right position in order to be able to work correctly. And when we're in that forward bent position, they're not in the right position and they're not going to be able to work correctly. Of course, unfortunately, things do not get better as we age. We tend to have more degeneration over time. Plus, we have less energy in our bodies to heal. And I get it, at my age, I don't want to hear that either, but it's science and it's just the truth. As we age, we have less energy to heal. It takes more of our available energy in order to be able to heal on a regular basis. And of course, some people have a rotator cuff injury from a trauma. So a fall or an accident that actually caused that tear in the rotator cuff. But here's the important thing. There are complete tears and then there are partial tears. So a complete tear is when the tendon, which attaches the muscle to the bone, is completely torn. That means there are no fibers that are connected anymore. I will say, if you have a complete tear of your rotator cuff, your body cannot fix this on its own because it doesn't have the lattice work to be able to heal. But what most people actually have is a partial tear of their rotator cuff tendons, which means there's some fraying. So some of the fibers are interacting, but some of them are not. And this is what the body is able to heal because there's a scaffold in place. There's something to build on in place, and it can help bring those other fibers together. So as we're moving forward through this video, what we're talking about, to be clear, is a rotator cuff partial tear. And if you don't know if you have a complete or partial tear of your rotator cuff, but you've had an MRI done, that's a really important question to ask your doctor, is what percentage of the rotator cuff is actually torn? Because that will give you an idea of how much healing your body needs to do. Who is most affected by rotator cuff injuries? Most commonly, it's people over 40 because as we age, we have some degeneration and things just don't move the way they used to. Obviously, athletes, especially who do overhead activities such as tennis or volleyball or swimming, that put that arm in that more susceptible position to a tear. As we mentioned earlier, with the poor biomechanics, people who sit at a desk all day and do not have good ergonomics at their workstation are more susceptible to a rotator cuff injury, especially when they go outside, when the sun's out and they're going out and they're doing their sports or their yard work or things like that, where they put themselves in the position for that rotator cuff to get injured. The often overlooked group with rotator cuff injuries, though, is parents or caregivers. Because when you're a parent or a caregiver, you tend to spend a lot of time in that forward bent position as you're, lifting or taking care of or changing or all of those things. And what happens is that we tend to develop that posture in our daily activities. And then we go to put something as simple as putting the dishes away. But all of a sudden we're in this forward bent position most of the time, and we try to do something like reaching overhead, and it causes some trauma to that rotator cuff. So how do you know if what you're suffering with is a rotator cuff injury if you haven't had an MRI yet? Well, you're probably going to have pain when you're reaching overhead or when you're reaching behind your back, or some people notice it when they're trying to reach into the back seat of their car. Most likely you will have pain or difficulty sleeping on that side. Most people won't be able to sleep on that side at all because it'll hurt too much. You'll start to notice some weakness progressing over time, and it'll become more difficult to lift things, and that can include like a water bottle or a coffee cup. It doesn't have to necessarily be heavy things. It can be even lighter things over time. You may also notice a clicking or a grinding sensation whenever you're moving that shoulder, because the rotator cuff is not working correctly. It's not holding that arm bone into that joint as well as it should, so it's causing a grinding in the joint. So if you feel like you do have a rotator cuff injury or you have an MRI that's already diagnosed it, what do you do about it? The most important thing to do initially is avoid the aggravating positions. So I don't want you to rest completely and not do anything, because movement is life and every tissue in your body is designed to heal itself as long as it's moving correctly. However, if it hurts to bring your arm overhead and you continually do that, that is going to continue the degeneration in the rotator cuff, which is not what we're looking for. So it is really, really important to avoid those painful positions or motions. Another thing we want to do is to decrease the mechanical stress on the rotator cuff so it can actually heal, which means we need to work on our posture. So you want to make sure that at all times your head is above your shoulders and your shoulders are above your hips. If you're standing, your hips are right over your feet. And we do want to keep that joint moving as much as we can pain-free. So the motions that you do have available that are pain-free, continue doing those regularly throughout the day, because motion is lotion. Now, when it's appropriate and you can do it pain-free, you do want to start strengthening exercises. Particularly, you want to be focused on the scapular stabilizers. So the scapula is the shoulder blade, and the shoulder blade is where all those rotator cuff muscles actually start from. So you want to make sure that your shoulder blade is sitting in the right position and is nice and strong so that the rotator cuff muscles are in the correct position. And that's probably one of the biggest mistakes that I see people make, is that they start to get this weakness in the rotator cuff, like they notice that they have difficulty lifting their coffee cup up in the morning, and they think, oh, I need to strengthen my shoulder. But the problem is, if your shoulder blade's not in the right space, then when you go to strengthen those rotator cuff muscles, it just makes everything actually worse instead of better. So if you are noticing that you're having a weakness, difficulty picking up your coffee cup, or even anything as small as that, focus instead on the scapular stabilizers to make sure that those shoulder blades are sitting in the right position so the rotator cuff muscles can work correctly. Another thing that is really important to do, especially if you have a recent rotator cuff tear, is you want to make sure that you're icing to decrease the inflammation. Now, there's lots of advice on icing on YouTube, but what I would recommend is 5 minutes of icing over the area that's painful up to every hour if possible. I understand that inflammation is a normal reaction, especially when there's been a trauma. However, we do want to control the inflammation and make sure that it's a productive inflammation. And what happens is that sometimes people won't ice because they're allowing their body to do that inflammation, and that inflammation increases so much that it actually impedes normal healing because that area becomes stagnant. So that's why it's important to move in pain-free range of motion and also ice for 5 minutes every hour to manage that inflammation and keep it productive. And an often overlooked thing when we're dealing with rotator cuff injuries is making sure that you're doing your deep breathing and activating that autonomic nervous system. So anytime we have pain, our body goes into that fight or flight. We start using these muscles up in here to breathe instead of that diaphragm. And just activating that diaphragm activates the vagus nerve, gets us out of that fight or flight, and helps restore that homeostatic position so that we're able to heal better. And here's the thing, it is really important to remember that when it's not a complete tear, your body is capable of healing itself. It will require consistency, it will require doing the right things, but your body has the capability to heal itself. And surgery should be the last option instead of the first option. I mean, just think about it. If you have surgery, you're automatically causing trauma because they have to cut through those tissues. So why not see if this will heal on its own, give it some time, be consistent, and see if you can avoid that surgery. Now, we regularly see rotator cuff tears here in the clinic, and we have implemented a new technique in order to help heal rotator cuff tears faster. We call it regenerative healing, and we use shockwave therapy to provide acoustic energy directly into those torn tendons and muscles to help accelerate healing, improve blood flow, improve cellular metabolism, decrease pain, and restore range of motion. The use of shockwave therapy can help to boost healing and make faster recovery times. So it's fantastic for an acute injury or a recent injury that just happened. However, if you have a chronic, stubborn rotator cuff injury, shockwave therapy can actually help to accelerate the healing in that. See, what happens is that a chronic injury, the body tends to kind of forget about. It's like, okay, I tried to heal that. It didn't actually work, so it's been going on for years. The great thing about the shockwave therapy is that even with those chronic injuries, it's able to restore that cellular metabolism and increase that blood flow so you can start to see progress even years after the initial injury. So we had a patient come in named Mike who for a year was not able to do any overhead lifting activities at the gym, which was really frustrating because he goes to the gym every single morning. However, he did not come in for any treatment until he couldn't do overhead activities at home. So he was doing some home remodeling projects and he had literally lost the ability to do anything overhead for more than a second. So even screwing in a light bulb, he couldn't do it because he couldn't hold his arm up overhead long enough to screw in the light bulb. Now, because it had been going on for so long, there was not only the rotator cuff injury, but there was the poor biomechanics of the shoulder. So he was sitting in that forward head posture, the shoulder was not moving correctly. So we did a combination of physical therapy to address those biomechanical issues, get that shoulder in the right position, fix his posture, and restore normal shoulder range of motion, while also using shockwave to directly heal the tendon and muscles of the rotator cuff. And now Mike is back to not only doing his household projects, but he is able to lift overhead every morning at the gym. So if you've been told that surgery is your only option for a rotator cuff injury, let's talk first. If you're in the Maple Valley, Washington community, I definitely would love to invite you in for a free discovery visit where we can hear your story and learn more about what's been going on with your rotator cuff issue. If you're not local, we do offer online health coaching to help you make the next best step in your health journey. And if Shockwave sounds really interesting and you want to try some regenerative healing, I'm going to encourage you to look in the description box below. We're going to include a contact for the company that we use, which is CuraMedics. They offer the only FDA-approved Shockwave device in the United States. So if you're interested in shockwave therapy, give them a call so you can find a provider near you.